Rich, tell us where you are. Where are you standing right now?
Good question. I'm actually standing right in front of the maternity ward at the General Hospital, or they also call it the University Hospital in downtown Port-au-Prince. This is, in certain ways, is ground zero for a lot of the emergency response from a medical standpoint. Within the city, I'm staring at a tent which was established by the Swiss government, but primarily for pediatric trauma, and has one of their 4 tents has been modified as a maternity ward. The tent inside. I mean, they've done a great job to get these things set up, but they're quite concerned, as I'm looking at it right now, about the very hot temperatures that are inside the tents. It's not sanitary. There's no flooring to the tent, so you can't do any infection prevention there. And I'm watching Haitian government Ministry of Health workers. Just one moment for the helicopter. Watching Haitian employees of the hospital that we're working with streaming into the maternity ward, cleaning it, preparing it, at least one of the operation theaters to begin services there. And what we're hoping is that we can move some, a portion today and as many as we can tomorrow of the maternity patients into the maternity, so we can open up that tent for pediatric trauma, which those cases unfortunately continue to come in.
Rich Lamport of JPIEGO. For folks who are not familiar with JPIEGO, that's JHPIEGO. We featured them, this organization, on our show a couple of months ago. What was JPIEGO's presence in Haiti before the earthquake? What were you doing there, Rich?
Well, JPIEGO's mission is to prevent the needless death of women and children. There's a lot that we know about preventing maternal mortality, infant mortality, child mortality, and we were working on those issues. And actually, we've been in country for 15 years, and we're really our mission is about building the Haitian capacity to be able to, one, produce the healthcare workers locally that they need, because there's a chronic shortage, and two, provide the latest and greatest information about the kinds of techniques that are most effective from around the world, so that they don't have to reinvent the wheel here in Haiti. So that's primarily what we've been working on.
I heard you reference Haitian medical staff, medical personnel helping there at the hospital where you're located, Rich. I thought Max Hilaire from Morgan State might have a question about that, because we were just discussing whether the government itself there, local government, is able to provide any assistance, any relief there. What is the presence of I don't know, Haitian authority, police, medical in Port-au-Prince?
To be honest, I've been impressed. Arrived last Thursday or Friday. It's hard for me to tell now, but I saw a Haitian police presence right away, and it looked like some effective presence. It's not like they have control of the whole city by any stretch. Within the hospital itself, there was personnel here. As one, of course, when the earthquake hit. But I've spoken with 3 people this morning that were here the day afterwards and have been working straight through. I think what happens is, we know that at least with maternity services for emergency obstetrical care, women in labor who are at risk of dying if they don't get attention, has sort of been pushed aside for good reason, because the trauma cases just has overwhelmed everyone. So basically, all the maternity services, people were asked politely to leave. So what we've done is helped to rally this group back together with the Haitian OBGYN Association and working with the Midwifery Association of Haiti to bring people back together. They've been called back to work by the Ministry of Health. I think that there actually is, it's not necessarily getting a lot of press, but there is a strong resurgence of Haitian officials, Haitian government workers, and especially healthcare workers that are coming back into the fold, and indeed have been working straight on through, side by side with a lot of the international groups. Who just they're not getting the press.
Rich, it's Max Soler here with Dan. I wanted to ask you, how does the health situation in Haiti compares to other disaster situations around the world that you've seen? And what are the prospects of Haiti rebuilding its health infrastructure or building a new one completely from scratch that is going to be sustainable and less dependent on the international community?
Great question. I mean, I can only speak from my experience. And post-Hurricane Mitch, which people said basically required Honduras back in the late 90s to completely establish itself as a country. But, here it's much more devastating because what you've got is just massive damage to the institutional infrastructure. All the buildings for the ministries, I didn't see a single one that was operational. Most of them actually flattened. I know that there's a number of officials that did not lose their lives, but there's a number that have. So it's going to take a while. In terms of the prospects, I don't think there's any question that there's strong prospects for Haiti to come back. If indeed we work hard on actually maximizing how the huge relief effort can be used for recovery. So that means as the work's being done now to maximize use of Haitian Haitian health providers. I'll give you an example. The midwifery school right now, right across from where I'm looking, there are 6 midwives there that are just finishing their training. They're standing out front waiting to be utilized. There's Haitian capacity here. My point is we're in a transition, and they have been, again, politely pushed aside, but they really need to be engaged now. Now, they actually need practice. And so part of what Japago is doing is providing support, supervision, mentoring, and, systems which have been, adapted, refined in multiple countries to be able to address needs. So I would say I'm encouraged that at least the health system, with time, can come back.
Rich Lamport is speaking with us from Port-au-Prince. He's with Japago. That's JHPIEGO. That's the International Health Organization affiliated with Johns Hopkins University with a specialization in maternal health and pediatric health. Thank you, Rich, for speaking with us. I hope we can connect again.